non-toxic multinodular goiter. So what's a nodule? Nodule is on examination, palpable swelling or lump of more than 1 centimeter in thyroid gland, whereas ultrasound detects more thyroid nodules, smaller ones, 25%, which are as small as 3 millimeter. Non-toxic multinodular goiters occur in 12% of the adults, more in women, more in elderly, and more in iodine deficient areas. Multinodular goiter, non-toxic. The architecture is distorted because they are multiple and the growth increase in size that causes distortion in architecture. Because of the multiple nodules of varying size, they cause pressure symptoms, trickle deviation. They may be asymptomatic, but the goiter, this is the gross pathology of the multinodular goiter, hemorrhages, fibrosis, scarring, and irregularly filled follicles. Fibrosis is often extensive. The features are of these multinodular goiter are same mnemonic almost C, D, E, F, G, H, R, S. Calcification, degeneration, fibrosis, growth, hemorrhage. There occur hyperplasia and involution in these nodules with irregular enlargement. See, they are irregularly enlarged. They are hypercellular regions filled with colloid. Hypercellular region filled with colloid. Scan or MRI. It evaluates the anatomy of the goiter and extent of the substernal extension. These are the multinodular goiter. So why do they occur? Most nodules are polyclonal in origin and they cause hyperplasia and hyperplastic because of the locally produced growth factors and cytokine. It may also be due to monoclonal lesions. Monoclonal lesions are due to mutation in the genes. Polyclonal lesions are due to growth factors and cytokines produced that cause hyperplasia and hyperplasticity. Mutation monoclonal that causes increase in adenylyl cyclase and cyclic AMP that lead to increased thyroid cell activity and function. And a long-standing iodine deficiency endemic goiter may also be converted to multinodular goiter. And iodine deficiency is the most common cause of endemic non-toxic goiter worldwide, whereas in the Western world, it's the biosynthetic defect. That's the most common cause. Clinical features of the multinodular goiter may be asymptomatic when it's small, but compression symptom. Dyspnea, dysphagia, dysphonia due to compression of trachea, esophagus, and obstruction to the recurrent laryngeal nerve that causes dysphonia that supplies the vocal cord. And trichomalacia causes inspiratory steroidal. I already told that dyspnea occurs when more than 70% of trachea is obstructed, and what test demonstrates esophageal obstruction is the barium swallow causes dysphagia. Sudden pain is usually due to hemorrhage or malignancy, and sudden pain and hoarseness may also be due to malignancy because hoarseness is due to the involvement of the recurrent laryngeal nerve that passes behind the thyroid gland to the vocal cords. So in multinodular goiter, non-toxic, thyroid function is usually normal. The risk of malignancy is same as that of solitary cold nodule, 5 to 10%. And what are the sonographic characters that suggest malignancy? I already explained. Microcalcification, hypoaquagenicity, and increased vascularity. Now, treatment of the non-toxic multinodular goiter. 3 treatments: thyroxine, radioactive iodine, and surgery, thyroidectomy. L-thyroxine is useful in the young people and halts the thyroid stimulation. Disadvantage of thyroxine is that it rarely decreases the thyroid size. It doesn't decrease the thyroid size. Which treatment decreases the thyroid size? It's radioactive iodine that decreases the goiter size by 50%. And second disadvantage that it may induce thyrotoxicosis. The calcium containing substances should not be used about 4 hours before or after taking the thyroxine substances. Example of calcium containing substances are antacids, milk, cheese, and yogurt. Now, if the multinodular goiter has autoimmunity as a cause, then iodine containing substances increase the thyroxine production, and a radioactive iodine, I already explained, that decreases the goiter size by 50%. And then, so after radioablation, electrical current and heat may also shrink the nodule. Surgery is effective, but it has risk. What are the risks with surgery? It may cause infection, it may cause bleeding, it may cause hypoparathyroidism, and it may cause statinin, decrease calcium. Normal calcium is 10 milligram per 100 ml, and it's the parathyroid hormone. Parathyroid hormone is four parathyroids are attached to the posterior surface of the thyroid gland. So if it's removed, they may also be removed, and it might cause hoarseness or defects in the voice because of damage to the recurrent laryngeal nerve that passes behind the thyroid.